Let's talk about diastasis recti and C-sections. Diastasis recti is the name when you've got an abdominal separation. The muscle down the middle of the tummy, the rectus abdominal muscle, can separate during pregnancy, and it often is quite challenging to rehabilitate that. It puts you at risk of hernia and can affect your digestive system. So that C-section scar, which we can see here, can actually cause some tethering, adhering to the muscle and preventing you or restricting your rehab ability, even if you're doing all of the correct exercises to get that diastasis recti closed. So what kind of treatment approach can you take to help support that client that's got diastasis recti and a C-section scar? We need to think about tightness that can be present during the lateral obliques and in that sides of the abdominal area. So we need to release off that tissue first. If you're doing some self-care for yourself, what you need to think about is doing some nice little stretches across your tummy in towards the midline on both sides. These techniques are best done without using any moisturiser, otherwise you just slide across the skin. Work all the way up until you're underneath the ribs and all the way down till you're past your C-section scar. And you may find you've got more tightness on one side than the other. This is a great way to warm up before working on the C-section scar itself. When you have an abdominal separation, the muscle position has changed, and rather than being tucked tight together and held through that central fascia, you get a sort of doming that can occur particularly when you start to do a sit-up, and you can get some tethering from the scar holding the muscle in that position, which is going to be particularly tight in the corners. By releasing off the C-section scar, we can help support that recovery of bringing that abdominal muscle together. Let's look at how you do that on the body. Perhaps you're not sure whether or not you've got abdominal separation. The way to check this is to put your hands below your belly button and push down while doing a very gentle crunch with your head, and you'll find that your fingers can sink down and you'll feel a gap. Test below your belly button and test above your belly button. You should feel that there might be a bit of a ridge in the muscle, but there should be a solid feel at the end of that. If you feel your fingers keep sinking down between two firm sides of the muscle, it's worth seeing a professional to get that checked. So with your scar massage, what you want to do is concentrate on releasing off tightness in the sides so that you can help support that muscle coming back together, so it's not being held in the wrong position because it's tethered by your C-section scar. In order to really support this, what I'm going to recommend is massaging one side at a time. Go beneath your scar and stretch up with a directional pull towards the midline. Start beneath your scar, go across and slightly up towards the tummy button. Lovely. This should be a little bit deeper once you come away from your scar, because here you're working on the muscles as well. Then we need to really soften off on the scar itself. So we're going to do some dry circles, moving the skin around, but with a real emphasis of coming in towards the middle. So round in a circle and then in towards the middle. That's really important to do on both sides. So perhaps do one at a time. Lovely. Make sure you position your hands below the scar when you do this. If you feel any sharp pains, stop, check with a medical professional before continuing. And then let's do the other side. Make sure you're beneath the scar, you're going in and around with a special emphasis towards the tummy button. Make sure you don't slide over the scar, so keep your hands stuck on the skin so you're not sliding on the skin now. Lovely, that's better. Just a couple of quick considerations. When you're in that very early postnatal stage, keep your pressure light. As you go through and your scar starts to mature at 10, 12 plus weeks, then you can steadily increase your pressure and your stretch, but take it easy on your body. You've still got tissues that are knitting together underneath, and we don't want to put too much strain on them in those early weeks. So small little stretches at the beginning, and then through those weeks work up to a more dynamic move. And you don't need to press down too hard. We really want to look at getting that nice tractional skin movement over the underlying layers to stop you developing scar adhesions. Well, hope that was useful, and check out the other videos we've made together on scar tissue.